So my people, recently we saw Kofi in our consulting room. I mean, he came in very sick, and according to him, he's been coughing for the past 3 weeks. And he says that whenever he coughs, he has a bit of chest pain. He says he's feverish, and he claims to have lost a bit of weight. Says that whenever he sleeps at night, he sweats a lot. Okay, so we examined him, did some investigations, and it turned out that he actually had tuberculosis. Okay, Kofi is actually worried and has been asking a lot of questions. Why and how did he get this disease in the first place? Today we are talking about tuberculosis, or TB, one of the most infectious diseases that has actually troubled humanity in ancient times. And despite advancement in medical sciences, it remains one of the most destructive conditions ever known. So we'll look at what tuberculosis is, we'll look at the spread, we'll look at the symptoms, and then we'll look at the prevention. Okay, but before we do that, please subscribe to this channel. My finding shows that some people are yet to subscribe to this channel, and kindly share this video with your loved ones. So what is tuberculosis? Tuberculosis is actually an infectious disease that is caused by a bacteria that primarily affects your lungs. Okay, but of course, it can affect other areas of your body, like your brain, your spine, even your abdomen. Okay, so it can affect your brain, spine, abdomen, but majorly it attacks your lungs. Now you must understand that tuberculosis is an airborne disease. Now what this simply means is that tuberculosis is spread through the air. Okay, so once you have someone with active tuberculosis and the person coughs or sneezes, it releases what we call droplets into the air. I mean the air that you and I breathe. Okay, if you are close by and you inhale or you breathe in this air, the droplet infection that contains the tuberculosis bacteria will go through your windpipe into your lungs. Now ideally, once the TB bacteria settles in your lungs, okay, your immune system is able to detect that there's a foreigner, there's an enemy that has invaded the camp, and so it sends army of soldiers to attack that enemy. Okay, this army of soldiers are what we call macrophages. Okay, macrophages are immune cells that attack any foreigner that enters your body. You see, in most cases, this immune response is enough to deal with the TB bacteria. But the thing is that not everyone is fortunate enough, because there are some groups of people whose immune system is suppressed or is compromised. Okay, actually 3 groups of people, in fact 5. The first group are people who have been diagnosed with HIV. The second group, people who have been diagnosed with diabetes. The third group, people who are malnourished. The fourth group, people who abuse tobacco, smoke a lot. The fifth group, people who drink excessive amounts of alcohol. These groups of people have their immune system suppressed, and so whenever a TB bacteria enters the lungs, they are unable to mount an immune response and fight that bacteria. And so because such groups of people are unable to fight back, okay, whenever there's an attack on the lungs, okay, by the TB bacteria, the bacteria is able to have a field day and is able to multiply, is able to reproduce and cause a lot of havoc. What are the symptoms of TB? So you see, when the bacteria is able to attack your lungs, okay, you can have all sort of symptoms. You can have chest pain, and in some cases patients begin to cough blood. Okay, sometimes the oxygen levels in your lungs is decreased, and it leads to all kinds of hormonal changes that can cause loss of appetite, leading to weight loss, can cause abdominal pain, it can cause back pain, fever, and even night sweats. So like I said earlier, when someone has the active TB, okay, and a person maybe sitting close to you coughs or sneezes and releases the droplet into the air, and you inhale the air, that's how you can get the TB bacteria into your lungs. But it's very important to know that not everyone with the TB bacteria, okay, in their lungs would be sick or even have symptoms. Okay, and because of that, TB has been categorized into 2 groups. We have the latent TB and then the active TB. The latent TB means that you have the bacteria all right, but you are not sick. You are not showing any symptoms, because I mean your immune system is able to deal with the bacteria. However, if you have the active TB, it means that you have the bacteria and you are sick, you are showing symptoms like the chest pain, the fever, the night sweats, and all that. The critical question now is there anything we can do to prevent TB? Yes, of course. There are some things that we can do to prevent tuberculosis. Number 1, please seek medical attention. You are sitting at home. You've been coughing for the past 3 weeks, 1 month. You've been taking cough mixture, cough syrup. It's not working. You are still coughing. And you are sitting at home. Please seek medical attention. You are feverish, unexplained weight loss. You are not on a ketone diet. You are not fasting. You know you are eating well, but for some reason, you are losing weight. Please seek medical attention. You see, the point is that if you go to the hospital and it's confirmed that you have tuberculosis and they put you on antibiotics, you see, early treatment can save your life and prevent the spread of tuberculosis to your close relatives or to people you live with in the house or in the community. Number 2, please get tested for tuberculosis, TB, especially if you have an increased risk for this condition, especially in patients who have been diagnosed with HIV. Okay, if you have been diagnosed with HIV and you notice that your chest is doing you some ways, like you are feeling some pain and you start coughing, please get tested for tuberculosis. And also, people who are in close contact with people who have tuberculosis, please get tested for TB. Number 3, please, if you don't have your own car and you're always using public transport and someone sitting close to you is coughing, if you have a nose mask, please use it. If you don't, the least you can do is to just use your handkerchief to cover your nose. That's the least you can do. And please, for those who have been diagnosed with tuberculosis, please practice good personal hygiene. Okay, if you are coughing or you are sneezing, please use a nose mask. And if you use a tissue to wipe your nose or something, please dispose it off properly to avoid or prevent or slow down the spread of tuberculosis. So my people, please, let's help end TB. Please be safe as you go out there, and kindly subscribe to this channel, like, share, and kindly leave a comment in the comment section. I'll see you in the next video. Bye bye.